In this video, we're going to look at some of the features we use to determine when there is right heart strain in a patient with pulmonary emboli. And one of the features is the actual embolic burden, in which case, especially in this situation where there's a saddle embolic component and multiple occlusive emboli in the main pulmonary vessels, the embolic burden is very high. And that results in back pressure in the pulmonary artery and the pulmonary trunk. And therefore, the first feature is that the pulmonary trunk diameter, which is in this case about 39 millimeters, is higher than the adjacent thoracic aorta, which is at slightly lower at 37 millimeters. Next, we go to the level of the interventricular septum. In this case, you can see it's flattened. And in order to appreciate this better, we have to get the planes in an orthogonal orientation, like so. And we are going to make everything in line and then change it into the sagittal plane, where we're looking at the ventricle en face. And we can see that when we get to about this level, we can see flattening of the interventricular septum. The next feature is to look at the overall proportions of the right ventricle and the left ventricle, and in some instances, this paradoxical right-sided cardiac chamber enlargement. A further feature is further backflow effects for contrast, and here we have contrast reflux into the azygous vein and other accessory veins, like in this case, superior intercostal vein coming through here, and also reflux into the hepatic veins. So this is a great case demonstrating features of extensive pulmonary emboli with saddle pulmonary emboli and with complicating elevated right-sided pulmonary arterial pressures and right heart strain. References containing links are highlighted below.